HY review. Gram-positive bacteria. 40 questions on the bugs, the NBME test most, staph, strep, the spore formers, and the tricky rods. Read the vignette, spot the clue, name the bug or its mechanism, and move. 40 questions, 60 minutes. Clock starts now. Which organism is most likely? A 28-year-old man who injects heroin has fever, chills, and a new murmur that increases with inspiration. Echo shows tricuspid valve vegetations, and there are septic emboli in the lungs. Blood cultures grow gram-positive cocci in clusters that are catalase positive and coagulase positive. Read the command, identify the organism. IV drug use, tricuspid endocarditis, clusters, coagulase, positive, Staph aureus. Staphylococcus aureus is the classic cause of acute, right-sided, tricuspid endocarditis in IV drug users, seeding septic pulmonary emboli. It forms gram-positive cocci in clusters and is uniquely catalase positive and coagulase positive among the staph, which is exactly how the lab describes it here. The correct answer is B. Streptococcus viridans causes subacute endocarditis on previously damaged valves and is catalase negative. Unlike the coagulase positive cluster former here, choice A wrong. Staphylococcus epidermidis is coagulase negative and infects prosthetic valves and catheters, not native tricuspid valves, in an IBDU, choice D wrong. This is Staphylococcus aureus. Which organism is responsible? Several people at a picnic developed sudden nausea, vomiting, and some diarrhea about 3 hours after eating potato salad and custard that sat out in the sun. Everyone recovers within a day. The illness is caused by a preformed, heat-stable toxin. Read the command, identify the organism. Rapid vomiting from a preformed, heat-stable toxin points to Staph aureus. Staphylococcus aureus food poisoning is caused by a preformed, heat-stable enterotoxin that is already in the food, so symptoms begin fast, within 1 to 6 hours, with prominent veomycin and quick recovery. Foods left at room temperature, like mayonnaise, custards, and dairy, are classic sources. The correct answer is A. Clostridium perfringens food poisoning has a later onset, about 8 to 16 hours, with watery diarrhea, because the toxin forms in the gut rather than being fully preformed, choice C wrong. Salmonella causes an invasive gastroenteritis with a longer incubation, not a 3-hour toxin-mediated illness, choice B wrong. This rapid toxin-mediated vomiting is Staphylococcus aureus. What is the mechanism of this toxin? A 19-year-old woman using tampons develops high fever, hypotension, a diffuse sunburn-like rash, and later desquamation of the palms. Cultures grow S. aureus producing a toxin that binds MHC class II and T cell receptors outside the antigen groove, activating enormous numbers of T cells. Read the command, the toxin mechanism. Toxic shock toxin is a superantigen. Toxic shock syndrome toxin, TSST1, is a superantigen. It bridges MHC class II on antigen-presenting cells to the TCEL receptor outside the normal peptide groove, activating a huge non-specific fraction of T cells. The resulting flood of cytokines, IL-1, IL-2, and TNF, produces fever, capillary leak, hypotension, and a diffuse rash with later desquamation. The correct answer is D. ADP ribosylation of elongation factor II is the mechanism of DIPH-3 toxin and Pseudomonas exotoxin A, which halt protein synthesis rather than activating T cells, choice A wrong. Lecithinase degradation of membranes is the alpha toxin of Clostridium perfringens in gas gangrene, unrelated to toxic shock, choice C wrong. Which toxin is responsible? A 2-year-old develops widespread redness followed by sloughing of the superficial skin so that gentle rubbing peels the top layer away. The mucous membranes are spared. The cause is the toxin that cleaves desmoglein knee in the stratum granulosum. Read the command, identify the toxin. Superficial skin splitting sparamucosa is staphylococcal scalded skin syndrome. Staphylococcal scalded skin syndrome is caused by S. aureus exfoliative toxin, which cleaves desmoglein 1 in the superficial S stratum granulosum. This splits the top layer of epidermis, giving a positive Nikolsky sign and sloughing that spares the mucous membranes, most often in young children. The correct answer is C. Streptococcal pyrogenic exotoxin A causes scarlet fever and toxic shock through superantigen activity, not the desmoglein cleavage that splits skin choice. A wrong. Diphtheria toxin halts protein synthesis and produces a pharyngeal pseudomembrane, not epidermal peeling choice. B wrong. This is a staphylococcal exfoliative toxin. What is the molecular basis of this organism's resistance? A skin abscess fails to improve on nafcillin and oxacillin. The lab confirms methicillin-resistant Staphylococcus aureus MRSA. Read the command, the resistance mechanism of MRSA. It is an altered target, PBP2A, from MECA. Massa resistance comes from the MECA gene, which encodes an altered penicillin-binding protein, PBP2A, that beta-lactam antibiotics cannot bind well. Because the D-road target itself is changed, MRSA resists all beta-lactams, including methicillin, nafcillin, and cephalosporins, not just the penicillinase-susceptible ones. The correct answer is E. Beta-lactamase, penicillinase, is the mechanism of ordinary penicillin resistance, which is exactly what methicillin and nafcillin were designed to overcome. MRSA has moved beyond it by altering the target choice. A wrong. A mutated DNA gyrase is the basis of fluoroquinolone resistance, not beta-lactam resistance. Choice D wrong. MOS-A resistance is an altered PBP2A encoded by MECA. Which two tests, in that order, accomplish this? A microbiology lab first needs to separate Staphylococcus from Streptococcus and then pick out Staphylococcus aureus from the other staph. Read the command, the two-step lab tree for gram-positive cocci. Catalase splits staph from strep, coagulase flags, S. aureus. Among gram-positive cocci, catalase separates the groups. Stop are catalase, positive, strep are catalase, negative. Then, within the staph, coagulase identifies S. aureus, which is coagulase, positive, versus the coagulase negative staph like epidermidis and saprophyticus. Catalase first, coagulase second. The correct answer is A. Optochin and biosolubility are used to identify Streptococcus pneumoniae, not to separate staph from strep. Choice B wrong. Vacitracin and the CAMP test are used to group the beta hemolytic streptococci, again not the staph pathway. Choice C wrong. The correct sequence is catalase, then coagulase. Which organism is most likely? A patient with a central venous catheter develops a persistent low-grade bloodstream infection. Cultures grow gram-positive cocci in clusters that are catalase, positive but coagulase, negative, form a slimy biofilm on the plastic, and are novobiocin sensitive. Read the command, identify the organism. Coagulase negative, biofilm on a catheter, novobiocin sensitive, S. epidermidis. Staphylococcus epidermidis is a coagulase, negative staph that adheres to and forms biofilms on prosthetic material, catheters, prosthetic valves, and joints. It is novobiocin sensitive, which separates it from S. saprophyticus. It is a common contaminant but a real pathogen on indwelling devices. The correct answer is C. Staphylococcus aureus is coagulase, positive, so it does not fit a coagulase negative isolate. Choice A wrong. Staphylococcus saprophyticus is also coagulase negative but is novobiocin resistant and causes UTIs, not device biofilm infections. Choice D wrong. This is Staphylococcus epidermidis. Which organism is most likely? A sexually active 20-year-old woman has dysuria and urinary frequency. Urine culture grows a gram-positive coccus in clusters that is catalase, positive coagulase, negative and novel biosyn resistant. Read the command, identify the organism. UTI in a young woman, coagulase negative, novel biosyn resistant S. saprophyticus. Staphylococcus saprophyticus is the second most common cause of UTI in young sexually active women, after E. coli. It is a coagulase negative staph distinguished from S. epidermidis by being novel biosyn resistant. The gram-positive cocci in clusters on culture rule out the gram-negative E. coli. The correct answer is B. Staphylococcus epidermidis is novel biosyn sensitive and infects prosthetic devices rather than causing community UTIs. Choice C. Wrong. E. coli is the most common cause of UTI overall, but it is a gram-negative rod, whereas the lab describes gram-positive cocci in clusters. Choice are wrong. This is Staphylococcus saprophyticus. What is the underlying mechanism of the heart damage? 3 weeks after an untreated sore throat, a 9-year-old develops migratory polyarthritis, a new mitral murmur, subcutaneous nodules, and a rash. Antibodies raised against the streptococcal M protein are found to cross-react with cardiac myosin. Read the command, the mechanism of rheumatic heart damage. Antibodies to M protein cross-react with the heart, molecular mimicry. Acute rheumatic fever follows untreated group, strep perennitis. Antibodies against the bacterial M protein cross-react with self-antigens in the heart, joints, and brain. Molecular mimicry, a type 2 hypersensitivity. This antibody-mediated attack, not direct infection, causes the carditis, migratory arthritis, and other Jones criteria. The correct answer is D. Immune complex deposition is the type 3 mechanism of post-streptococcal glomerulonephritis, a different sequela, not the cross-reacting antibodies of rheumatic carditis. Choice B wrong. Direct bacterial invasion does not occur. The heart damage is immune-mediated, arising weeks after the infection has cleared. Choice wrong. Rheumatic fever is molecular mimicry. What is the mechanism of the kidney injury? 2 weeks after a streptococcal skin infection, a child develops cola-colored urine, periorbital edema, and hypertension. Labs show elevated anti-DNase B, and renal biopsy shows subepithelial immune complex humps. Read the command, the mechanism of post-strep kidney injury. Subepithelial humps are immune complexes. Post-streptococcal glomerulonephritis is a type 3 immune complex disease. Antigen-antibody complexes deposit in the glomerular basement membrane, seen as subepithelial humps on electron microscopy, triggering a nephritic picture, cola-colored hematuria urine, edema, and hypertension. It follows either strep pharyngitis or skin infection. The correct answer is E. Molecular mimicry is the type 2 mechanism of rheumatic fever, which attacks the heart and joints, not the immune complex process behind this glomerulonephritis. Choice are wrong. A superantigen drives toxic shock and scarlet fever, not the deposition of immune complexes in the kidney. Choice C wrong. PSGN is immune complex deposition. Which virulence factor most directly allows this organism to spread rapidly through the subcutaneous tissue? A patient develops a rapidly spreading, exquisitely painful soft tissue infection with systemic toxicity. Surgery reveals necrosis tracking along the fascial planes, and cultures grow Streptococcus pyogenes. Read the command, the factor that lets S. pyogenes spread through tissue. Hyaluronidase digests ground substance. Necrotizing fasciitis by S. pyogenes spreads fast because the organism secretes hyaluronidase, the spreading factor, which degrades hyaluronic acid in the connective tissue ground substance and opens tissue planes. Along with streptokinase and DNases, it lets the bug race along the fascia, the flesh-eating picture. The correct answer is C. Coagulase is a Staphylococcus aureus enzyme that clots plasma and helps wall off an abscess, the opposite of spreading. And S. Pyogenes does not make it. Choice A wrong. Lecithinase is the Clostridium perfringens alpha toxin of gas gangrene, not a strep spreading factor. Choice D wrong. Rapid spread is due to hyaluronidase. Which organism is responsible? A 7-year-old has fever, sore throat with tonsillar exudates, and tender anterior cervical nodes, plus a diffuse sandpaper, rash, and a strawberry tongue. Throat culture grows beta hemolytic gram-positive cocci in chains that are bacitracin sensitive. Read the command, identify the organism, pharyngitis with scarlet fever, beta hemolytic, bacitracin sensitive, group A strep. Streptococcus pyogenes group A causes pharyngitis and scarlet fever. The sandpaper rash and strawberry tongue from erythrogenic pyrogenic exotoxin. It is beta hemolytic and bacitracin sensitive, the classic lab pair that separates group A from the bacitracin resistant group B strep. The correct answer is A. Streptococcus agalactiae group B is bacitracin resistant and causes neonatal disease, not scarlet fever in a school-aged child. Choice B wrong. Buildin streptococci are A-alpha hemolytic and cause dental caries and subacute endocarditis, not exudative pharyngitis with a sandpaper rash. Choice E wrong. This is group A Streptococcus pyogenes. Which organism is most likely? A 5-day-old whose mother received no prenatal screening develops fever, poor feeding, lethargy, and a bulging fontanelle. CSF grows a beta hemolytic gram-positive coccus that is bacitracin resistant, CAMP test positive, and hydrolyzes hippurate. Read the command, identify the organism. Neonatal meningitis, beta hemolytic, CAMP positive, bacitracin resistant, group B strep. Streptococcus galactiae, group B, is a leading cause of neonatal meningitis, sepsis, and pneumonia, especially without maternal screening at 35 to 37 weeks. Its lab signature is beta hemolytic, CAMP test positive, hippurate positive, and bacitracin resistant, the mirror image of the bacitracin sensitive group, a strep. The correct answer is E. Listeria monocytogenes also causes neonatal meningitis, but it is a gram-positive rod with tumbling motility, not a CAMP positive coccus in chains. Choice B wrong. E. coli is another neonatal meningitis cause, but it is a gram-negative rod, not the gram-positive coccus described. Choice C wrong. This is group B Streptococcus agalactiae. Which post-streptococcal complication does timely antibiotic treatment reliably prevent? A 7-year-old with group A streptococcal pharyngitis is promptly treated with a full course of penicillin. Read the command, which sequela treatment prevents? Antibiotics prevent rheumatic fever, not PSGN. Timely antibiotic treatment of group A strep pharyngitis reliably prevents rheumatic fever, but it does not reliably prevent post-streptococcal glomerulonephritis. That is why a strep throat is always treated to head off rheumatic carditis, even though the same treatment does little to stop PSGN once the immune process is triggered. The correct answer is B. Saying post-streptococcal glomerulonephritis is prevented is incorrect. Treatment does not reliably stop it, which is a classic testing point. Choice A wrong. The two sequelae are not equally affected. One is preventable with antibiotics, and the other largely is not. Choice C wrong. Treatment prevents rheumatic fever, but not glomerulonephritis. Which organism is most likely? A 70-year-old man has fever, a productive cough with rust-colored sputum, and lobar consolidation on chest X-ray. Sputum shows lancet-shaped gram-positive diplococci, and the colonies are alpha hemolytic. Read the command, identify the organism. Rust-colored sputum with lancet-shaped diplococci is pneumococcus. Streptococcus pneumonia is the most common cause of community-acquired lobar pneumonia. The classic clues are rust-colored sputum, lancet-shaped gram-positive diplococci, and alpha hemolytic colonies. Its polysaccharide capsule is its key virulence factor. The correct answer is D. Klebsiella causes a lobar pneumonia with thick currant jelly, sputum in alcoholics and diabetics, and it is a gram-negative rod, not gram-positive diplococci. Choice are wrong. Staphylococcus aureus pneumonia classically follows influenza and appears as clusters, not lancet-shaped diplococci. Choice B wrong. This is Streptococcus pneumoniae, which is the most likely cause, being the most common bacterial meningitis in adults. A 68-year-old presents with fever, severe headache, neck stiffness, and confusion. CSF shows many neutrophils, low glucose, and high protein, with gram-positive diplococci on gram stain. Read the command, the most common adult bacterial meningitis. Gram-positive diplococci in an older adult, pneumococcus. Streptococcus pneumonia is the most common cause of bacterial meningitis in adults and the elderly. The bacterial CSF pattern, high neutrophils, low glucose, high protein, Clostridium, positive diplococci on stain point straight to pneumococcus. The correct answer is A. Listeria meningitis is a major cause in adolescents and young adults, but it is a gram-negative diplococcus, not the gram-positive one described. Choice B wrong. Listeria is a leading cause specifically in neonates, the elderly, and the immunocompromised, and it is a gram-positive ROD, not a diplococcus. Choice C wrong. This is Streptococcus pneumoniae. Which lab profile identifies Streptococcus pneumoniae? A lab has an alpha-hemolytic gram-positive coccus in chains and must confirm whether it is Streptococcus pneumoniae or a virulent Streptococcus. Read the command, the lab profile for pneumococcus, optochin sensitive and biosoluble. Streptococcus pneumonia is optochin sensitive and biosoluble, and its capsule swells on the Quellung reaction. These two tests separated from the viridans streptococci, which are optochin resistant and bioinsoluble. Both are alpha hemolytic, so these tests are how you tell them apart. The correct answer is C. Optochin resistant and bioinsoluble describes the viridans streptococci, the very group you are trying to distinguish pneumococcus from. Choice are wrong. Bacitracin sensitivity is the test for group A strep, not for identifying pneumococcus among alpha hemolytic strains. Choice B wrong. Pneumococcus is optochin sensitive and biosoluble. Which organism is the greatest concern in an asplenic patient? A child with sickle cell disease has functional asplenia and is at very high risk for overwhelming infection. Vaccination against encapsulated organisms is emphasized. Read the command, the top concern in asplenia, encapsulated organisms led by pneumococcus. The spleen clears encapsulated bacteria by opsonization and filtration, so asplenic patients, including those with sickle cell disease, are dangerously susceptible to them. Streptococcus pneumonia is the leading such threat, along with H. influenzae type B and N, meningitis, which is why these patients are vaccinated against encapsulated organisms. The correct answer is E. Staphylococcus aureus is not the classic asplenia-associated pathogen, and its coagulase has nothing to do with splenic clearance of capsules. Choice are wrong. E. coli's endotoxin is a gram-negative feature unrelated to the encapsulated organism risk that defines asplenia. Choice B wrong. The chief concern is the encapsulated Streptococcus pneumoniae. Which organism is most likely? A 55-year-old with a previously scarred rheumatic mitral valve develops subacute bacterial endocarditis a few weeks after a dental cleaning. The organism is alpha-hemolytic, optochin resistant, and adheres to the valve using dextran glycocalyx. Read the command, identify the organism. Subacute endocarditis on a damaged valve after dental work, dextran adherence, viridans strep. Viridans Streptococcus, like S. sanguinis and S. nutans, live in the mouth and cause subacute endocarditis on previously damaged valves after dental procedures. They stick to the valve via dextran in glycocalyx. They are alpha hemolytic and optochin resistant, which distinguishes them from pneumococcus. The correct answer is B. Staphylococcus aureus causes ACUT, endocarditis, on normal valves and is not the post-dental damaged valve organism described. Choice are wrong. Streptococcus pneumoniae is optogene sensitive and does not typically cause dental-associated endocarditis. Choice C wrong. This is viridans streptococci. Beyond treating the endocarditis, what workup is specifically indicated? A 66-year-old develops endocarditis and blood cultures grow Streptococcus galolyticus, formerly S. bovis. Read the command, the workup triggered by S. bovis. Bovis in the blood means look in the colon. Streptococcus galolyticus bovis, bacteremia, and endocarditis are strongly associated with colorectal cancer. The memory hook is bovis in the blood, cancer in the colon, so any patient with S. bovis endocarditis needs a colonoscopy to look for an occult colonic malignancy. The correct answer is D. A dental evaluation is what you associate with viridans strep endocarditis, not with the colon cancer link of S. Bovis, choice B, wrong. An echocardiogram alone confirms the endocarditis, but misses the crucial colon cancer association that makes S. bovis special choice A wrong. S. bovis calls for a colonoscopy. Which organism is this, and what does growth in bile plus hypertonic saline indicate? An 80-year-old man develops endocarditis after a genitourinary procedure. Blood cultures grow a gram-positive coccus in chains that grows in bile, and in 6.5% sodium chloride, and it is resistant to vancomycin. Read the command. Identify the organism. Growth in bile and 6.5% knuckle after a GU procedure. Enterococcus. Enterococcus. E. faecalis. E. faecalis. E. is a hardy group. D. gram-positive coccus that grows in bile and in 6.5% sodium chloride, a combination that separates it from S. bovis, which grows in bile but not in hypertonic saline. Enterococcus utilized in endocarditis, especially after GU or GI procedures, and vancomycin-resistant strains VRE are treated with linezolid or daptomycin. The correct answer is A. Streptococcus galolyticus bovis is also group D and grows in bile, but it does not grow in 6.5% nacelle, which is exactly how Enterococcus is distinguished from it. Choice B wrong. Staphylococcus aureus grows in clusters, not chains, and is not defined by the bile plus saline profile. Choice D wrong. This is Enterococcus. Which organism is responsible? A farmer who handles sheep hides develops a painless skin papule that enlarges and ulcerates into a black coal-like ester surrounded by marked edema. Gram stain shows large gram-positive rods and chains that form spores. Read the command. Identify the organism. A painless black eschar after animal exposure is cutaneous anthrax. Cutaneous anthrax, caused by Bacillus anthracis, produces a painless papullae that becomes a black eschar, the malignant pustule, ringed by prominent edema after contact with infected animals or hides. The organism is a large, spore-forming, gram-positive rod in chains, and it carries a unique polypeptide D-glutamate capsule. The correct answer is E. Staphylococcus aureus skin lesions are painful and purulent, not a painless black eschar. And Staphylococcus in clusters, not large rods. Choice are wrong. Streptococcus pyogenes causes painful spreading cellulitis and necrotizing infection, again as cocci in chains rather than spore, forming rods. Choice C wrong. This is Bacillus anthracis. Which component binds host cells and enables the other two toxin subunits to enter? A wool mill worker inhales spores and develops flu-like symptoms that rapidly progress to widened mediastinum, hemorrhagic mediastinitis, shock, and death. The anthrax toxin has 3 parts. Read the command, the toxin part that mediates entry. Protective antigen is the binding translocation component. The anthrax toxin is an AB toxin with THRE parts. Protective antigen is the binding B component. It attaches to host cells and forms the pore through which the 2 active subunits enter. edema factor and adenylate cyclase, raising camp enzyme E, edema, and lethal factor A protease are the active parts, but neither can get into the cell without protective antigen. The correct answer is C. Edema factor is an active subunit that raises camp to cause edema, but it depends on protective antigen to enter the cell. Choice A wrong. Lethal factor is the protease responsible for cell death, yet it too cannot enter without protective antigen carrying it in. Choice B wrong. The component that binds and enables entry is protective antigen. Which organism is responsible? Several people at a buffet developed vomiting about 2 hours after eating reheated fried rice. The illness is caused by a preformed heat-stable toxin and spores that survived the reheating. Read the command. Identify the organism. Reheated fried rice with rapid vomiting is Bacillus cereus. Bacillus cereus causes the classic reheated fried rice food poisoning. Its spores survive the initial cooking and germinate when the rice is kept warm, producing a preformed heat-stable emetic toxin quinacerulide that triggers rapid vomiting within a few hours. A separate, later-onset diarrheal form also exists. The correct answer is B. Staphylococcus aureus also causes rapid, toxin-mediated vomiting, but its classic sources are mayonnaise, dairy, and custards, not the reheated fried rice that flags B. Serious choice. Choice are wrong. Salmonella causes an invasive gastroenteritis with a longer incubation, not a 2-hour preformed. Toxin illness. Choice C. wrong. Reheated rice points to Bacillus cereus. What does the toxin cause and how? A man steps on a rusty nail and about a week later develops muscle rigidity, lockjaw trismus, a fixed grimace, rhisis sardonicus, and painful spasms. The responsible toxin blocks the release of the inhibitory neurotransmitters, glycine and GABA, from spinal inhibitory Renshaw neurons. Read the command. The effect and mechanism. Blocking inhibitory transmitters causes spastic paralysis, tetanus, tetanospasmin. The toxin of Clostridium tetani blocks the release of the inhibitory neurotransmitters glycine and GABA from spinal inhibitory neurons. Without inhibition, motor neurons fire unchecked, producing spastic paralysis, lockjaw, rhizus sardonicus, and rigid spasms. It is the mirror opposite of botulinum toxin. The correct answer is D. Flaccid paralysis from blocking acetylcholine release is the mechanism of botulinum toxin, the exact opposite of tetanus, which produces rigidity. Choice A wrong. Raising camp to cause watery diarrhea is the mechanism of cholera toxin, not a neuromuscular effect. Choice B wrong. Tetanus causes spastic paralysis by blocking glycine and GABA. Which organism and toxin is responsible? A 4-month-old infant is floppy, with a weak cry, poor feeding, constipation, and a descending flaccid paralysis. The parents recently gave the baby honey. The responsible toxin blocks acetylcholine release at the neuromuscular junction. Read the command. The organism causing floppy baby after honey. Blocking ACA release causes flaccid paralysis, botulism. Infant botulism occurs when Clostridium botulinum spores, famously from honey, germinate in the infant gut and release toxin that blocks acetylcholine release at the neuromuscular junction. The result is a descending flaccid paralysis, a floppy baby with weak cry, poor feeding, and constipation. Honey is avoided under age 1 for this reason. The correct answer is E. Clostridium tetani produces the opposite picture, spastic paralysis from blocking inhibitory transmitters, not the flaccid floppy presentation here. Choice are wrong. Poliovirus can cause flaccid paralysis, but it is a virus with asymmetric involvement and no link to honey or to blocking ACH release. Choice D wrong. This is Clostridium botulinum. Which organism is responsible? After a deep, dirty crush wound, a patient develops rapidly spreading muscle necrosis with crackling gas in the tissues, crepitus, and a foul, watery discharge. The organism produces an alpha toxin, elastase, that degrades cell membranes. Read the command. Identify the organism. Gas gangrene with lecithinase alpha toxin is C. Perfringens. Clostridium perfringens causes gas gangrene, Clostridium myocrosis in deep contaminated wounds. Its alpha toxin is a lecithinase phospholipase that destroys cell membranes, driving rapid tissue death and producing gas in the tissue, the crepitus you feel. It is a spore-forming anaerobic gram-positive rod. The correct answer is A. Streptococcus pyogenes causes necrotizing fasciitis, but it spreads along fascia via hyaluronidase without the tissue, gas, and lecithinase of Clostridial myocrosis. Choice C. Wrong. Clostridium tetani causes spastic paralysis, not muscle necrosis with gas. Choice E. Wrong. Gas gangrene with lecithinase is Clostridium perfringens. Which organism is responsible? Several guests develop watery diarrhea and cramps about 10 hours after a catered meal of reheated meat and gravy. Symptoms resolve within a day. The toxin forms after ingested spores germinate in the gut. Read the command. Identify the organism. Later onset watery diarrhea after reheated meat is C. Perfringens food poisoning. Clostridium perfringens also causes a common food poisoning, distinct from its gas gangrene. Spores in reheated meat survive and germinate, then produce toxin in the gut, so onset is later, about 8 to 16 hours, with watery diarrhea and cramps that resolve within a day. It is one of the most common causes of foodborne illness. The correct answer is C. Staphylococcus aureus food poisoning starts much sooner, 1 to 6 hours, and is dominated by vomiting from a fully preformed toxin, not the later watery diarrhea here. Choice are wrong. Bacillus cereus is tied to reheated fried rice, and its emetic form causes rapid vomiting rather than this delayed diarrhea from reheated meat. Choice B. Wrong. This is Clostridium perfringens. Which organism is responsible? A hospitalized patient on clindamycin develops profuse watery diarrhea, fever, and crampy abdominal pain. Colonoscopy shows yellow-white pseudomembranes on the colonic mucosa, and stool is positive for toxins A and B. Read the command. Identify the organism. Post-antibiotic pseudomembranous colitis with toxins. A, B is C. Difficile. Clostridioides difficile causes antibiotic-associated pseudomembranous colitis. Antibiotics, classically clindamycin, but also fluoroquinolones and cephalosporins, wipe out normal flora and let C. difficile overgrow and release toxins A and B, which damage the mucosa and form the yellow pseudomembrane seen on colonoscopy. The correct answer is B. Shigella causes a bloody, invasive dysentery, not the antibiotic-associated pseudomembranes described here. Choice E. Wrong. E. coli O57 H7 causes bloody diarrhea and hemolytic uremic syndrome, again without pseudomembranes or a toxin. A. B. stool assay. Choice D. Wrong. Post-antibiotic pseudomembranous colitis is Clostridioides difficile. What is the appropriate management? A patient develops Clostridioides difficile colitis after a course of clindamycin. Read the command. How to treat. C. Difficile. Stop the culprit antibiotic. Use oral L vancomycin or fidaxomicin. For C. Difficile colitis, stop the offending antibiotic and treat with oral vancomycin or fidaxomicin. Oral vancomycin works precisely because it is not absorbed and stays in the gut lumen where the organism lives. This is the one setting where oral vancomycin is used for its local luminal effect. The correct answer is D. Intravenous vancomycin does not reach the gut lumen in adequate concentration, so it fails to treat. C. Difficile colitis. The drug must be given orally here. Choice B. Wrong. Continuing the offending antibiotic sustains the disruption of normal flora that let C. difficile overgrow in the first place. Choice wrong. Treat with oral vancomycin or fidaxomicin after stopping the trigger. Which organism is responsible? An unvaccinated child has a severe sore throat with a thick gray pseudomembrane over the tonsils that bleeds when scraped, marked neck swelling, bull neck, and then develops myocarditis. Read the command. Identify the organism. Gray adherent pseudomembrane, bull neck, and myocarditis in an unvaccinated child is diphtheria. Corynebacterium diphtheria causes diphtheria, a thick gray pseudomembrane on the pharynx that bleeds when removed, cervical swelling giving a bull neck, and toxin-mediated complications like myocarditis and neuropathy. It is a club-shaped gram-positive rod, and disease occurs in the unvaccinated. The correct answer is E. Streptococcus pyogenes causes exudative pharyngitis, but the exudate is not the adherent, bleeding gray pseudomembrane with bull neck and toxin-mediated myocarditis of diphtheria. Choice A wrong. EBV causes infectious mononucleosis with a membranous exudate, but also splenomegaly and atypical lymphocytes. Not this toxin-driven picture. Choice C wrong. What is that mechanism? The toxins of Corynebacterium, diphtheriae, and Pseudomonas aeruginosa exotoxin A kill cells by the same enzymatic mechanism acting on a host protein. Read the command, the shared toxin mechanism. Both inactivate EF2 by ADP ribosylation. Both DIP-eth eriotoxin and PS-E-dominase exotoxin A inactivate elongation factor 2 by ADP ribosylation. With EF2 disabled, the ribosome cannot translocate along mRNA, so protein synthesis halts and the cell dies. This shared mechanism is a classic paired fact. The correct answer is A. ADP ribosylation of the G's protein to raise camp is the mechanism of cholera and pertussis toxins, which cause secretory and other effects rather than halting translation. Choice B wrong. Cleavage of snare proteins is how botulinum and tetanus toxins block neurotransmitter release, unrelated to protein synthesis. Choice C wrong. Diphtheria toxin, ADP ribosylates. EF2. Which groups are classically at risk for Listeria meningitis? An elderly, immunocompromised patient develops meningitis and CSF gram stain shows gram-positive RODS. Listeria monocytogenes is suspected. Read the command, the at-risk groups for Listeria. Extremes of age, pregnancy, and immunocompromise. Listeria. Monocytogenes causes meningitis, chiefly in those with weaker cell-mediated immunity. Neonates, the elderly, pregnant women, and the immunocompromised. It is one of the few gram-positive rods that cause meningitis, which is why empiric coverage in these groups must include an agent active against Listeria. The correct answer is C. Otherwise healthy young adults are the classic group for Neisseria meningitis, not Listeria, which favors the vulnerable population's choice. A wrong. Splenic patients are especially prone to encapsulated organisms like pneumococcus, a different risk category than Listeria's. Choice D wrong. Listeria targets neonates, the elderly, pregnant women, and the immunocompromised. Which antibiotic is a treatment of choice? A pregnant woman develops a febrile illness after eating unpasteurized soft cheese and deli meats, raising concern for transmission to the fetus. Listeria is confirmed. Read the command, the drug of choice for Listeria. Ampicillin. Cephalosporins do not cover Listeria. Listeria is treated with ampicillin. A crucial point, cephalosporins do not cover Listeria, which is exactly why empiric meningitis regimens in neonates, the elderly, and pregnant women ADD ampicillin to a cephalosporin. Unpasteurized dairy and deli meats are the classic sources in pregnancy. The correct answer is D. Ceftriaxone is a cephalosporin, and cephalosporins have no reliable activity against Listeria. Using it alone would leave Listeria untreated. Choice A wrong. Vancomycin targets resistant gram-positives like MRSA, but it is not the first-line agent for Listeria. Choice B wrong. The treatment of choice is ampicillin. Which best describes its motility and spread? Listeria monocytogenes spreads directly from one cell to the next without entering the extracellular space, escaping antibodies, and it shows a distinctive motility when grown at room temperature. Read the command. Listeria's motility and spread. Actin rockets for cell-to-cell spread plus tumbling motility. Listeria hijacks host acetine, polymerizing it into rocket tails that propel the bacterium directly from one cell into the next, spreading cell to cell without ever entering the extracellular space, so antibodies cannot reach it. In broth at room temperature, it also shows a characteristic tumbling motility. It even grows at cold refrigerator temperatures. The correct answer is B. Listeria is definitely motile, so calling it non-motile and purely bloodborne is incorrect. Its actin-based and tumbling motility are hallmark features. Choice D wrong. Flagellar swarming across agar is characteristic of Proteus, not the intracellular actin rocket spread of Listeria. Choice A wrong. Listeria uses actin rockets and tumbling motility. Which organism is it, and how is it treated? After a dental extraction, a patient develops a slowly progressive jaw neck abscess that drains through sinus tracts containing yellow sulfur granules. The organism is an anaerobic, branching, filamentous gram-positive rod that is not acid-fast and is part of normal oral flora. Read the command, identify the organism and treatment. Cervicofacial sulfur granules, anaerobe, not acid-fast, actinomyces, penicillin. Actinomyces israelii is an anaerobic, branching, filamentous gram-positive rod of the normal oral flora. After dental trauma, it causes a cervicofacial abscess draining sulfur granules through sinus tracts. It is not acid-fast and is treated with penicillin. Captured by the mnemonic snap, sulfur for nocardia, actinomyces gets penicillin. The correct answer is E. Nocardia is the aerobic, partially acid-fast counterpart treated with sulfonamides, not the anaerobic, non-acid-fast actinomyces described here. Choice A wrong. Mycobacteria are acid-fast and treated with ripe, unlike this non-acid-fast oral anaerobe. Choice B wrong. This is actinomyces treated with penicillin. Which organism is it, and how is it treated? A patient on chronic high-dose steroids develops a pulmonary infection together with a brain abscess. The organism is an aerobic, partially acid-fast, branching filamentous gram-positive rod that is urease positive and found in soil. Read the command, identify the organism and treatment. Aerobic, partially acid-fast, pulmonary plus brain abscess in immunocompromised. Nocardia, sulfonamides. Nocardia is an aerobic, partially acid-fast, branching filamentous rod from soil. In immunocompromised patients like those on chronic steroids, it causes pulmonary disease that can spread to the brain, forming abscesses. It is treated with sulfonamides TMP, SMX, the S of the SNAP mnemonic, sulfur for nocardia. The correct answer is C. Actinomyces is the anaerobic, non-acid-fast counterpart treated with penicillin, the opposite of this aerobic, partially acid-fast organism. Choice or wrong. Mycobacterium tuberculosis is fully acid-fast and treated with ripe, and it does not fit the partially acid-fast, soil-associated nocardia. Choice B wrong. This is nocardia treated with sulfonamides. Which set of contrasts is correct? A student is contrasting actinomyces and nocardia, which are both branching filamentous gram-positive rods. Read the command, the correct actinomyces versus nocardia contrast. Anaerobe penicillin versus aerobe partially acid-fast alpha. The pair splits cleanly. Actinomyces is an anaerobe, not acid-fast, part of oral flora, causing cervicofacial abscesses with sulfur granules treated with penicillin. Nocardia is an aerobe, partially acid-fast, from soil, causing pulmonary and CNS disease in the immunocompromised, treated with sulfonamides. Mnemonic, SNAP, sulfonocardia, actinomyces nocardia. The correct answer is A. The reverse mapping, making actinomyces the aerobe and nocardia the anaerobe, flips both organisms' oxygen requirements and treatments. Choice B wrong. They are not both anaerobes. Nocardia is a strict aerobe, so calling both anaerobes is incorrect. Choice C wrong. The correct contrast is choice A, per the SNAP mnemonic. Which of the following is a classic catalase-positive pathogen in this disease? A boy with chronic granulomatous disease, whose neutrophils cannot generate the respiratory burst, defective NADPH oxidase, suffers recurrent infections specifically with catalase-positive organisms. Read the command, a catalase-positive organism in CGD. Among the options, Staph aureus is catalase-positive. In chronic granulomatous disease, neutrophils cannot make hydrogen peroxide, so they depend on the microbe's own peroxide to kill it. Catalase-positive organisms destroy that peroxide and thus survive, causing recurrent infections. Staphylococcus aureus is a classic catalase-positive culprit, whereas all the Streptococci are catalase. The correct answer is D. Streptococcus pyogenes, like all Streptococci, is catalase, negative, so it supplies peroxide that even CGD neutrophils can use to kill it. Not a classic CGD pathogen choice, or wrong. Streptococcus pneumoniae and the other strep are likewise catalase negative choices, B and C wrong. The catalase positive organism here is Staphylococcus aureus. Which classification is correct? On blood agar, 3 Streptococci are compared. One produces a green discoloration around the colonies, partial hemolysis. One produces a clear zone, complete hemolysis, and one produces no change. Read the command, match hemolysis types. Alpha green partial, beta clear complete, gamma none. Hemolysis on blood agar comes in 3 patterns. Alpha, hemolysis is partial, turning the agar green EAG, pneumococcus viridans. Beta hemolysis is complete, giving a clear zone, EAG group A and B strep S aureus. Gamma means no hemolysis EAG. Enterococcus, non-enterococcal group D. This green clear non-scheme is a core first step in enterococcal group D. This green clear non-scheme is a core first step in identifying strep. The correct answer is B. Calling alpha complete and beta none scrambles the definitions. Alpha is the partial green reaction and beta is the complete clear one choice, A wrong, making alpha none. And gamma complete likewise reverses the scheme, choice, C wrong. The correct match is alpha green partial, beta clear complete, gamma none. That's the block, 40 reps on the gram-positive buzz, 60 seconds to lock the patterns. Catalase splits staph from strep, coagulase flags aureus. Novobiosine then splits the coagulase, negatives epidermidis sensitive, saprophyticus resistant. Pacitresin splits group, A sensitive from group B, resistant. Optochin and bile solubility flag, pneumococcus. Bovis in the blood means cancer in the colon. Tetanus is spastic. Botulinum is flaccid. Opposite toxins. Perfringens makes gas. C. Diphtheria makes pseudomembranes after antibiotics. Diphtheria and Pseudomonas exotoxin, A both ADP ribosylate EF2. And remember SNAP, sulfur for nocardia, actinomyces gets penicillin. Train process, not memorization. StepLogic, learn how to think, not memorize. Next up in the micro series, gram-negative bacteria.